Hello, my name is Bailey Gooch, and this is my in-service project presentation on the inside scoop of OTs working in skilled nursing facilities. So to start off, I am going to go over my 3 learning objectives. So my first learning objective is that learners will identify at least 3 distinctions about a SNF when compared to other types of facilities. The second is learners will list 2 or more daily tasks of an OT practitioner working in a SNF. And the third is learners will identify 3 or more common assessments or interventions used by OTs working in a SNF. So now we're going to watch a YouTube video, and I'm going to go ahead and share my screen.
So Teresa, we've discussed previously what independent living is. We've discussed what assisted living is. And I've heard a lot about these SNFs. People talk about SNFs and it's some kind of a community, but I'm not exactly sure what the acronym is. What is a SNF?
The SNF is a skilled nursing facility.
Okay. And so why do we need a skilled nursing facility? We said previously that we've got people on hand in assisted living place. Who goes to a SNF?
So a SNF is going to be short-term care up to 99 days, and that would be someone who has just come out of a hospital and they're not ready to go home. They're not ready. The doctors are not releasing them to go home and take care of themselves. So they may have to go into the short-term care and stay there for up to 99 days, and they're going to receive physical therapy.
Okay.
They might need occupational, they might need speech therapy. The therapies are there to get them back to their baseline to be able to return home.
Okay, all right. So it is a rehab center then?
Yes, part of it is,
Okay.
and then part of it is a long-term care. And so in the long-term care is more of a nursing setting where they have 24-hour care.
Okay, so that's the difference, because I know we have rehab facilities, but the difference then between a SNF and a rehab facility is that the SNF has both rehab and some long-term care.
Correct.
Okay, that's interesting. Thank you. Perfect.
So to start off, let's talk about what a skilled nursing facility is, or what a SNF actually is. So in the world of OT, we hear the words nursing home and SNF thrown around a lot. But do we really know what they are? A lot of times the terms are used interchangeably, but are they really the same thing? And what makes a SNF different from other care facilities like assisted living? So today we're going to talk about all of this. So I want you guys to take a second and think about what you think a skilled nursing facility is. So now I want you to take a second and think about what makes a SNF different from other types of care facilities like assisted livings, or what you think of a typical nursing home. Okay, so as we already know, SNF stands for Skilled Nursing Facility. According to seniorliving.org, a skilled nursing facility is a place that provides skilled nursing care and/or rehabilitation services to help individuals who are sick, disabled, or injured get back to their normal life. So what is skilled nursing care? To get this definition, I went to our older adults textbook. So according to our textbook, Functional Performance in Older Adults, nursing home care can be thought of as falling into 3 categories: skilled, rehabilitative, and custodial. I want you guys to remember the definitions that I'm about to tell you because you're gonna need them for later on. So rehabilitative care includes stays of several weeks to several months, during which time the individuals is expected to improve and return to their least restrictive environment. Custodial care is long-term residential care, and skilled nursing care provides high-level medical care immediately after hospitalization, including some subacute and some ventilator care. So, according to our older adults textbook, a Medicare certified SNF unit may be located within a freestanding nursing home or a hospital. Clients can't access SNF units directly without a hospital stay. The need for rehabilitation is a major criterion that qualifies someone for a SNF. Clients in SNF settings must receive daily rehab skilled services such as PT, OT, or SLP. Clients must demonstrate measurable progress during the duration of their stay, and thorough documentation is needed for continued care. So all of this may still seem a little bit complicated, which it is, but to try and simplify it a little bit more, I actually interviewed one of I call her my mentor, but she works in a nursing home that has a skilled nursing facility in it. And the way that she explained the distinction to me was in nursing homes, you have nursing home residents and you have skilled nursing facility residents. Not every nursing home resident is receiving skilled nursing facility services. So what's the difference between skilled nursing facilities and other facilities like assisted living? So skilled nursing facilities are considered a medical setting, while assisted living facilities are considered residential. Another big difference in these facilities is that SNFs are typically for the short term being relative, because like in the video said, up to 99 days. And assisted living is considered long-term, and this can be years. Another difference between these facilities is the goals. So the goal of a SNF is to help the client return to their prior level of functioning or help the client return and get their independence back. While the goal of assisted living is to help the client get to their desired level of independence while still getting assistance for ADLs and IADLs, like cooking and cleaning and money management. So what's the difference between a SNF and a nursing home? This is where it gets kind of sticky. So the primary differences between a SNF and a nursing home are the types of services provided and the goals of the services provided. So a nursing home provides custodial care, which I mentioned earlier. These are why those definitions are important. This is long-term residential care. These clients require help with ADLs and IADLs and receive most of their care from licensed nurses. So the goal for these clients is for them to be as safe and as comfortable as possible, and they are unable to live independently. And this is compared to a SNF where the goal is to regain independence. So what does an OT do in a SNF? So before this in-service, I asked you to review a blog by OT Miri. And the blog is actually a summary of a video, but the video is really long, so I didn't ask you guys to watch it. So in the video or in the blog, OT Miri is interviewing Mary Kate Carroll, who works as an OT in a skilled nursing facility. Of course, OTs working in SNFs use the same general process as OTs working anywhere else. You have your evaluation and then you do your treatment. When asked what the role of an OT in a SNF was, she said it's all based on what the client needs to do in order to return home or to their discharge location. I really liked this definition because of how client-centered it was. So OTs in skilled nursing facilities cover a broad scope, including ADL and IADL training, functional mobility training, compensatory techniques, education and practice with adaptive equipment, strengthening, promotion of functional activity tolerance, and standing balance. So all of this sounds really familiar, right? These are all things that we've talked about in our adults courses and our older adults courses. So OT Carroll also mentioned that she does a lot of home evaluations with caregivers, family members, and the clients, and she makes discharge recommendations. OTs in SNF settings also do things like help clients explore new leisure pursuits and address potential home and environmental modifications. So what does a typical day look like for an OT in a SNF? And this goes, they go more in depth in the blog post about this, but OT Carol said that her day typically starts around 7 a.m. and she usually has 1 to 3 evaluations, and then she treats her regular clients, and she usually has 7 to 8 clients per day with documentation after each client. And around midday, there's a staff meeting or rehab team meeting where she collaborates with other professionals in the skilled nursing facility setting, including PT and SLP. So who are skilled nursing facility clients? One of the things that I really wanted to address during this presentation is client age. A lot of times when we hear nursing home or skilled nursing facility, we automatically think older adults, but this isn't always the case. Skilled nursing facilities clients can range in age from young adult to older adults. So common diagnoses OTs see in skilled nursing facilities. OTs in skilled nursing facilities address any diagnosis that is limiting client independence, but some of the most common diagnoses seen in skilled nursing facilities are brain injuries, strokes, orthopedic injuries, UTIs, post-joint replacement surgery, cancer, pneumonia, or other acute cardiopulmonary dysfunction. So common interventions and problems that are addressed by OTs in skilled nursing facilities. We've already talked a little bit about this, but I wanted to break them down a little bit further. So typically, skilled nursing facility OT treatments include occupation-based interventions that emphasize ADL and IADL retraining. This includes especially working on things like self-care activities, such as bathing and toileting. OTs often incorporate preparatory activities prior to their treatment sessions, and these include things like targeted therapeutic exercise, modalities, activity tolerance training, balance retraining, and cognitive interventions. Some specific examples of things that may be addressed by OTs in skilled nursing facilities include things like transfer safety when transferring to and from a wheelchair, preparing for community reintegration using activities like practicing dining out in public, and exploring compensatory strategies for returning to employment or volunteering. Common assessments used by occupational therapists in skilled nursing facilities. We've talked about most of these, so when I say the name, they should be familiar. You guys should know what I'm talking about. So some common assessments include the Barthel Index, the Mini Mental, the Arm Curl Test, the patient-specific functional survey, and then your typical range of motion and manual muscle testing. Other assessments often used in SNFs include the box and blocks, the 9-hole peg test, and the quick dash. When asked what assessment she preferred to use in the video with OT Carol and OT Miri, she said that she uses the Barthel Index on almost all of her clients. So I hope this presentation has been insightful and helped kind of clear the waters a little bit in regards to what a SNF is and what an OT does in a SNF. I hope that it's really given you the inside scoop on OTs and skilled nursing facilities. There's a knowledge check listed on Blackboard, and I ask that you would complete that. And I hope you enjoyed this presentation, and I thank you so much for your time.